Let's talk hypnosis. Let's start off by just going through the contents of this presentation, looking at the 10 misconceptions about hypnosis, talking about what hypnosis is not, what hypnosis is, and how I, as a non-medical hypnotherapist, use hypnosis to help my clients. Starting with the 10 misconceptions. The first misconception is that hypnosis or hypnotists have special powers and that hypnosis is not a natural process. Hypnosis takes place in the alpha stage, and during this stage, your conscious mind is active, so you are not in anyone's power, and nobody can take control of you. You cannot at any time be made to do things you do not want to do. Hypnosis cannot make you act against or abandon your moral code. Another misconception is that when you are in hypnosis, you can be made to say or do something against your will. Not true. You cannot be made to say or do funny things unless you want to, of course. You will also not suddenly blurt out your darkest secrets. Another misconception is that hypnosis will only work on certain people. It's not true. Although only about 10% of people is highly hypnotizable, hypnosis is, in essence, self-hypnosis, which means that anyone who wants to be hypnotized can be hypnotized. Another misconception is that people who get hypnotized are weak-minded. The contrary is true. It is people who can concentrate well and have a creative imagination. In other words, strong-minded people that makes the best hypnotic subjects. So strong-minded people actually are better hypnotic subjects. Hypnosis can be bad for your health. That's not true. Hypnosis is a form of relaxation. So quite the opposite is true. All medical practitioners would agree on the health benefits of deep relaxation. Another misconception is that you can get stuck in hypnosis and be unable to wake up. Hypnosis takes place in the alpha stage. So this is not true. You cannot get stuck in hypnosis and you will not be unable to wake up as you're not asleep. You do not become in any way unconscious or semi-conscious. You are totally aware of yourself and your surroundings at all times. Another misconception is that you're asleep or unconscious while in hypnosis. It's not true. You do not go to sleep or become unconscious. You are totally aware of yourself and your surroundings at all times. You'll be able, or you'll become dependent on the hypnotist. That's not true. That's not true. You have conscious awareness during hypnosis and are in full control at all times. In hypnosis, you'll be able to recall everything that's ever happened to you. That's not the purpose of hypnosis. Hypnosis induces trance, a relaxing type of trance. So hypnosis is more about sitting back, laying down, relaxing, and enjoying the experience. Hypnosis is dangerous and it's the devil's work. This is utter nonsense. Hypnosis takes place in the alpha stage, where your conscious mind is present and it's a form of relaxation similar to that of prayer. So, one can easily say that prayer also can be described as a hypnotic state. What hypnosis is not, it's not magic. It's not a magic wand. It's not mystical. It is natural. And hypnosis is really effective after just one session. It is not sleep. Hypnosis is not sleep. It's a form of relaxation. It is not flamboyant or weird. It is natural. It's not a truth serum. With hypnosis, no one can be made to say or tell anything they don't want to. So what is hypnosis? All hypnosis is self-hypnosis. It's natural self-hypnosis. Even when used in surgery, it is self-hypnosis. Just going to show you a couple of videos. The first one is about surgery with hypnosis as the sole anesthesia during the repair of an umbilical hernia. And during this video, the person is fully in control, fully aware of what's happening, without any pain, without unnecessary blood loss. So just look at this video and see how effective it actually can be.
Ready?
Yeah.
Okay.
Clinical hypnosis is an incredible tool that mental health and healthcare professionals can use to help individuals to learn to tap into the wealth of resources that exist in the unconscious mind. This is a video showing the extremes of what is possible. Surgery with no anesthesia or pain meds of any kind, and no measurable blood loss, using only self-hypnosis. The surgery is for an umbilical hernia repair with a mesh plug being inserted.
We're going to put a little instrument in here that will spread.
The mind and body are intricately connected. Clinical hypnotherapists can teach individuals how to access the power of the mind to help make the changes they are wanting to make in their lives. During the surgery, you can see that I am alert and awake and talking to the doctor. All of the suggestions for pain management and bleeding control I gave myself ahead of time as post-hypnotic suggestions, so they occur as needed.
It's this instrument that's pushing, it's pulling apart the edges so we can see down deep. You got the, go ahead and give her the...
This is a tool that is clearly so much more than a hypnosis stage performance or party trick. We invite you to visit the American Society of Clinical Hypnosis on the webpage www.asch.net to learn more about this amazing tool.
So that's it. And now let's look at this woman having an operation to her throat, and to prevent any damage to her voice cords, she was requested to sing, and this was done while hypnotized.
What doctors are calling a world first, a woman sang during throat surgery while under hypnosis. 31-year-old Alama Kante, who's a professional singer, underwent throat surgery in France to remove her thyroid gland. Doctors used the unconventional method of hypnosis rather than anesthetics and told her to sing throughout the operation to make sure they didn't damage her vocal cords. I met with the anaesthetist to know how it would go, and they called me afterwards to say, no, we are not going to do it because you have a professional job with your vocal cords. We can't take the risk of sending you to sleep and perform such an operation. So they proposed hypnosis so that I sing, so the doctor knows where to find the cords that he must not touch. Medical hypnosis allows the patient to remain awake and respond during the operation, but Alama described the feeling as being in a dreamlike state. It's an operation which happens as if you were in a dream, and at the time you're conscious of what is happening. I was in pain, but it was like I was not there. I was not myself. Alama sings traditional African songs and is set to release a new album.
And then there was another example of an operation done.
Science.
We create tranquility for the patient.
Laissez vos paupières s'abaisser.
This is also to create tranquility for the medical team. One of the fundamentals is to avoid sudden noises, which would bring the patient out of her hypnotic state. Secondly, the surgeon and his helpers, even the anesthetist, must control their emotions the whole time. Keeping calm is very important, because if the surgeon is agitated, the patient feels it. In this operating theatre, the anesthetist is also a hypnotist. We are in the Saint-Luc University Hospital in Brussels. Belgium is in the forefront of hypnotism for surgery, more so than, for instance, France, Switzerland, or the US. Saint-Luc's has been using it for 7 years. Studies show that surgery under hypnosis compared to general anesthetic improves a lot of things. Notably, there's comfort after an operation. With anesthetic, people don't sleep well, their consciousness is affected, but with hypnosis, they immediately feel more normal. It improves scar healing. After surgery, pain is reduced, and so it reduces the use of painkillers.
En post-opératoire. Un petit peu la
For
nuque aussi,
operations where local anesthetic is sufficient physically but falls short of guaranteed comfort, hypnosis is proving a valuable alternative to full anesthetic.
And looking at another video, the doctor's in, and more about the benefits of hypnotherapy or hypnosis.
Well, we've all seen it in the movies, right? People staring at that swinging pocket watch 1 minute, hypnotized the next, and then suddenly they're clucking like a duck on a stage in front of everybody on YouTube, right? Hypnosis is supposed to put folks in a deep trance and is able to change their behavior in one way or the other. And now we're hearing about medical hypnosis, where patients actually overcome a number of physical problems. Dr. Richard Furshine is the medical director of the Furshine Center for Comprehensive Medicine right here in New York. And Doc, you say some of your patients have used hypnosis. In what capacity?
Well, I recommend hypnosis, and I've actually used hypnosis for my patients. There was a study that just came out last week, and it was published in the Scandinavian Journal of Gastroenterology. And what they found was that patients that were put under hypnosis had a 40% reduction in the number of cases of individuals who suffered with irritable bowel syndrome. Now, that was important not only for that study, but another study which showed 7 years later, 85% of those patients also had a reduction in symptoms. I use it for people who have asthma, who are dealing with drug addiction, smoking problems, and pain problems.
Now, you're not hypnotizing us right now, right? There's no sort of secret thing that's happening. No, you don't do hypnosis yourself. Do you send your patients to a specialist? Is that how a patient of yours would get hypnotized?
Well, I do both. I've actually been trained in hypnosis, and I've also recommended my patients go to certified hypnotherapist. There is a problem with hypnosis at this point. It's not a certified specialty, so people need to be careful about where they go for these particular treatments. It's why I recommend that most patients go to physicians who've been trained.
So what is the difference between, say, positive visualization or meditation and hypnosis?
Well, the first stage of hypnosis is really the induction phase, and that's the place where we give people information that helps them to relax. We'll generally put them in a calm state of mind. They may visualize something, a calm river or a stream.
I'm sort of relaxing right now just thinking about it. Go ahead, Doc.
Yeah, and you put that in your mind, and that allows you to be primed to be induced and into a state of a trance. Now, about 85% of the population go into a trance, 15% can go into a deep trance, 15% are resistant. So even though some people are resistant, they still get the benefits of hypnosis.
Okay, so let's say it works for one of your patients. How long will it work? How long will it affect their behavior?
Well, in this particular study I mentioned, it had a significant effect 7 years after the treatment was stopped. So people go into a specific protocol. They might do 6 to 8 treatments. And then what we'll do is we'll monitor them, and if they need additional tune-ups, we'll put them in for a tune-up. I think one of the things that's so interesting about hypnosis is now we actually have the research that's showing that it works in PET scans and MRIs that actually look at hypnosis. We've been able to look at the right and left side of the brain, and what we find is that people under hypnosis are fully aware not only of what they're doing. It's not that they are not aware, they're fully aware, but they're able to activate parts of their brain that would not be activated if they were just to visualize.
You know, it's interesting to see the list. The Wall Street Journal had a list of things that hypnosis can affect, from phobias to smoking to weight loss to dental work. Does insurance cover it?
Not at this point. You know, again, if you go as part of a traditional office visit, when your doctor's examining you and evaluating you, many times that could be part of what the treatment program is. So this is something that's very effective. It's going to be very cost effective. And I have a feeling that this is going to become a very important part of our standard medical care, particularly when we know we don't have to use medications and we don't have to use treatments that, like, you know, painkillers, which can be very toxic.
Very attractive for that reason, but be careful, as you mentioned, about the credentials. There's nothing standardized for states, so you really have to do your research before you just launch in to getting hypnotized. All right, Doc, nice to see you again. Dr.
Thank you very much for having me.
Great to have you.
Human mind is very powerful.
That's right, it is. And so, continuing, in Belgium, in the Belgium hospital, hypnotherapy or hypnosis has been used since 1992 as a substitute to anesthesia.
Liège Hospital in Belgium is...
Let's have a look at that.
Liège Hospital in Belgium is pioneering surgical hypnosis. Since 1992, the anaesthetists here have used hypnotic techniques in over 5,000 operations. Leading the team is anaesthetist Marie-Elisabeth Feymonville.
The reaction at the beginning was they were surprised that I would like to use it. But when I asked the surgeon if he agreed that we used hypnosis, he gave me his confidence that it will be correct.
Today, Natalie Vandenbroek is having an operation on her neck to remove a growth on her thyroid. This is invasive surgery. The procedure takes an hour and a half and would normally be carried out under general anesthesia. Natalie has chosen to have the operation under hypnosis. She has never been hypnotized before.
I heard about hypnosis from my sister-in-law. She had it 10 years ago for the same surgery, and she was very happy from the result.
At Liège, there are no practice sessions. This will be the first time Professor Feymonville hypnotizes Natalie.
I have no guarantee that she can find the hypnotic state very easily. I work with her in the operating room, and then I will discover it is easy or not. I cannot say it before.
The surgical team here at Liège uses hypnosedation, hypnosis in combination with tiny amounts of intravenous sedation and local anesthetic. Compared to a general anesthetic, this combined approach means a 70% reduction in the amount of drugs used.
Dans ces couleurs, d'autres couleurs, des ombres qui changent les couleurs et la lumière qui transforme la couleur. I think everybody had access to this special state that we call hypnosis.
There are people probably who are more susceptible than others, and what that translates to is how long it would take you to get that person into a hypnotic state.
Out of the 50 surgical procedures the team performs each day, an average of 4 will use hypnosedation.
This technique gives something that we have not with other techniques. It permits the patient to maintain consciousness and to be comfortable during the procedure.
The Liège team are in no doubt as to the huge benefits of hypnosedation in surgery.
They avoid the patient being placed in a medically induced coma. The patient breathes for himself, takes care of his cardiovascular parameters by himself, and requires trivial amounts of medicine, which means all the kind of small but real anesthetic risks are diminished significantly.
For the team, however, there are disadvantages.
The team must learn another technique. The team must learn to work differently together. The team must change working habits, and at the beginning it's more workload.
Et vous trouvez la douceur de l'endroit qui vous permet d'apprécier plein de...
The culture in the operating room is completely different. We decrease noises. We are very concentrated on the patient, and I think it's more respectful to the patient.
We speak very slowly, there's no noise around, no telephone ring, and we mainly communicate by moving the head, moving the hand. We don't speak a lot, except the anesthesiologist in charge of the hypnosedation.
It helps the surgeon and the anesthesiologist to concentrate on their work.
The anesthetist is totally focused on the patient from the beginning to the end, and it requires absolutely massive concentration and massive energy. If you've done 2 hypnoses in a morning, you are absolutely ready to go to bed because you're completely exhausted.
After an hour, Nathalie's thyroid growth is finally removed.
Okay, voilà, comme ça, voilà. Okay.
It was a nice trip.
Okay.
It's clearly different, especially at the end of the procedure. I was speaking very clearly with the patient. She was happy. She thanks us. This is clearly different, and in terms of the end of the procedure, it's faster. It's much faster.
Patients get back to their full energy levels very much more quickly than after general anesthetic.
I feel really relaxed and really normal. I was really confident in it before, but I was really amazed pleasure I had.
I think the model we have developed here, combining hypnosis with sedation and local anesthesia, is possible in every country, in every hospital. Only people must be motivated to change their habits.
So there you have it.
Liège Hospital in Belgium is
Just,
pioneering surgical
continue.
hypnosis.
So we said that all hypnosis is self-hypnosis, even during surgery. Hypnosis takes place when the brain is in the alpha stage, and the cycles per second varies between 7 and 14. There are 4 stages. The beta stage. During the beta stage, the activity of the brain has 14 plus cycles per second. So you're awake and you're alert, focused, and fully aware of your surroundings. Your conscious mind is highly active, critical, and in control. Your ability to reason, analyze, and calculate is at its highest, it's optimal. In this phase, in this beta phase, your subconscious mind is still actively providing information to your conscious mind, the information that your conscious mind needs to draw conclusion and make decision as you interact with the world out there. The second phase is the alpha phase. During this phase, the brain activity is between 7 and 14 cycles per second, and this is a cycle in which hypnosis actually lives. So, as I said, your brain function is between 14 and 7 cycles per second. Your mind and your body becomes more and more relaxed the deeper you go into the alpha state. Your awareness becomes more focused and your levels of alertness decreases the deeper you go. Your conscious mind is less active, is less and less active as the alpha state deepens. Your conscious mind is less analytical and less critical of any incoming information, which means that your subconscious mind becomes highly receptive and your ability to visualize and conceptualize is greatly increased. We as humans move in and out of this light alpha state a number of times during the day. When we take a moment to contemplate something, to reflect on something, and when we take a moment just to recall information from the subconscious mind, where it is easier to picture, visualize, and imagine, and it is easier to recall information. The next stage is the theta stage, which is deeper. It's deeper than alpha. It is the sleep stage. At the sleep stage, your conscious mind starts shutting down, and the brain activity is between 4 and 7 cycles per second. And as you go to deep sleep, the delta stage, the brain cycle, the brain activity is at a cycle of between 0 and 4 cycles per second. And typically, you go through all the stages, all the sleep stages, 3 to 5 times a night. 3 to 5 times a night, you go from alpha to theta to delta, back to theta, back to alpha, and then at the alpha, that's where the rapid eye movement occurs, and then back to theta, delta, and so this cycle repeats itself 3 to 5 times a night. Hypnosis is a totally natural state that you might find yourself in at various times through the day, even when driving along a familiar road, reaching your destination without recalling most of the road, without recalling whether you stopped at the green traffic lights and whether you drove through the green traffic lights and stopped at the red traffic lights. You're in autopilot, and your subconscious mind leads you to automatically adhere to what is best for you, to protect you and to act in your best concern. Hypnosis is a trance-like state in which you have heightened focus and concentration that is powerful for promoting healing, growth, and transformation. It is a state of relaxation. And in this state of relaxation, the unconscious mind is free to act without interference from regular consciousness. It's a natural creative state of mind and body where new learning can occur effectively and almost effortlessly. So as non-medical hypnotherapist, I apply hypnosis for the following, not limited to it, but for the following. Very effectively for stop smoking, helping people to stop biting their nails, help people overcome fears and phobias, and to turn down tinnitus. That can be a real problem. People may suffer from tinnitus, having hardship to concentrate, hardship to sleep. So with hypnosis, I help people to turn down this nuisance sounds, to overcome procrastination, to stop stuttering, help people get over relationship breakups, overcome the fear of commitment. And it's very effective for rapid stress relief. I help a lot of people with that. Managing stress, managing anger, helping people to develop positive thinking, changing I'm not so great into I'm great, changing their I can't into I can, changing their no's to yes, just positive thinking for a positive, better mindset. Very effective, helping people maintain healthy eating habits, helping people maintain healthy habits, managing weight, controlling weight and weight loss. Studying success, very effective for supporting studying success and exam success. Helping people boost their self-esteem, becoming bigger, better, stronger, happier, more confident, more content, just becoming bigger and better and just improving their self-esteem in a healthy, assertive way rather than an aggressive way. Getting the balance between passive and aggressive, getting the balance right between the interest of others and interest of self, getting to the balance between that, getting that right, and becoming assertive with better self-esteem. Improving relationships, helping people to overcome unforgiveness and help them to progress towards forgiving others and also forgiving themselves. Increase productivity at work, getting people in that productivity set of mind frame. A winner's mindset, developing a winner's mindset, improving interview confidence, developing dating confidence. People suffering from waking up tired is very effective. Hypnosis is very effective of helping those people wake up fresh and alert. Let's speak about forgiveness. Release of anxiety, very, very good for release of anxiety. Self-motivation, to overcome depression and deal with what causes the depression. So thank you for having a look at this presentation. Should you require more information, you could go to the website, World Wide Web, wellnesstherapy.co.za, or send us an email for more information at info@wellnesstherapy.co.za, or call 082 468 6960 and schedule an appointment. Thank you very much.